2-3 months at home, no shoes, eventually your feet are like, they give up. I'm Dr. Madelaine Franklin. I'm a chiropractic physician and medical director of Franklin Chiropractic and Physiotherapy Center. The last 2 to 3 months, most people have been at home. Some people are still at home. It's a more sedentary life. And what we find ourselves is from working from home is that we're not always in the best position. So most people will start working on the dining room table, others are working on the bed, some are even lying on the floor working. So what we find is that the body starts to get tired in those positions, and you start getting bad posture, you start developing headaches, lower back pain. So definitely working from home, if you haven't set up a proper desk and a workstation over this period of time, those are the type of patients we are definitely seeing. So the body doesn't adapt well to bad positions for long periods of time. So also in a work environment, you find yourself being interrupted by colleagues, or you get up for a quick lunch or get some water. You're moving around a whole lot more than what you do at home. So we have had patients complain they sit maybe 6 or 8 hours a day now continuously without moving, and they find themselves in pain, either with the low back pain or the neck pain. So definitely I think the dining room table has been the biggest culprit for most people, with a hard chair, a flat back, so but their head's right over, and so that develops a bit of the anterior head carriage. And the other thing is with laptops. So most people have taken a laptop home to do the work, but I mean, laptops in reality is only designed to be, mobile for you to do a quick email or traveling with it. It's not meant to be your workhorse that you sit on all day long. So we find it's way too low. People again are looking down onto it. They haven't set it up onto a laptop stand. So it changes the ergonomics completely. And that's what we find. So obviously, if people haven't or don't know about ergonomics, they haven't changed the setup at home to the best possible position for their spines. So yeah, I don't think we have adapted very well. And so those that will continue to work at home, maybe for the next couple of months, should definitely invest in a better chair, invest in a desk, get a laptop stand, get an external keyboard so that you can put your body into a better position. So you have to adapt. You have to adapt to it, and that's ergonomics. They came in with neck pain, headaches, migraines that were triggered off. So the most common treatment that we do for that is releasing the neck muscles, releasing all the tightness in the front, and obviously as a chiropractor we do the spinal manipulations. So those patients that the neck literally pulls tight and out of alignment, we would say, that's where we do the spinal manipulation. But everything we do is always working with the muscles, working with the joints, working with the ligaments. We never just work with the joints or the muscles. Everything works together. So the type of treatment is chiropractic and physiotherapy to help those type of patients. So that was one of the common ones. And again, it comes back to the workstation, working on the laptop, and that was what gave the anterior head carriage. The second most common was the lower back. So we found those were the ones that were sitting more onto the lounge. If you're sitting on your couch at home, you're not sitting on your bum bone, you're slouching down, so you're sitting more onto your back. And those patients were getting sciatica pain, the glutes were getting really tight, and that was just flaring up the sciatic nerve, so a lot of pain going down the legs. Now the third most common one, which was a very interesting one, which I didn't expect, was foot pain. So more people weren't wearing shoes at home. So a lot of people that have flat feet or fallen arches or overpronating ankles, weak ankles, they were actually getting more foot pain, and that was purely because they weren't wearing their shoes. A lot of those patients wear orthotics into their shoes as well, so they kept having pain underneath their arches, and it was purely because they didn't wear their shoes and were walking on tiled floors, cement floors, wooden floors for a period of time, and that definitely aggravated. Or doing exercise. So everyone went into the exercise phase, and doing all the Zoom exercises, but they were doing the exercises without putting on their sneakers, so their feet didn't have good support. So we had a lot of patients that had pain underneath their feet and they had no idea why, and that was pretty much why, because you're not wearing your shoes, and you're not wearing your shoes when you're working out. So it's great to not wear shoes in a natural environment like grass or sand. That's absolutely fine. Wearing it at home with no shoes for a couple of hours is fine, but as soon as you start talking about 2-3 months at home, no shoes, eventually your feet are like, they need a bit of support, they give up. So yeah, so that was the interesting one. Definitely, you have to warm up properly. So if your muscles haven't been working properly for the last 2-3 months, just give good stretches. And secondly is the roller. So you get a foam roller or even the hand roller, and do it before you go to the gym. So at home, roll your legs, your quads, your calves, really get those muscles working out so that you can start getting the fibers nice and parallel again. Sometimes they bunch up, you'll find them really tight in the quads and the glutes. So just give yourself a good couple of minutes of rolling before hitting the gym, and that already is going to just eliminate some strains that could possibly develop if you hit onto the treadmill straight away or going on hard onto the cycle. So absolutely, give it a nice roll, give it a nice stretch. And then the old traditional, once you finish, definitely do a cool down so that all the muscles can start relaxing again. Again, either onto the roller, good stretches, get yourself a nice tennis ball and do a couple of trigger points wherever you find that your muscles are a little bit sore. Press it against the wall like that, or put it on the floor, sit on it, find those glute muscle trigger points. So definitely start just manually releasing it. So roller, hand roller or tennis ball will definitely help those muscles just relax a bit. But at the end of the day, don't think that you were where you were 2-3 months ago when you stopped. Definitely take it a notch or two down and work your way out from there. So yeah, unfortunately we've got muscle memory, and muscle memory also forgets. So that's why we become weaker. So that's why we have to continue to build up back to where we were.